This should have ended differently. In 1982, a man named Kenneth Pinion was driving through rural Washington state when his car veered off the road and plunged into a ravine. The fall was violent. The vehicle was crushed. By all reasonable expectations, he should have died on impact. But he didn't. Pinion survived the crash, injured, shaken, but conscious, which tells us something important right away. Despite the damage to the vehicle, his vital organs were still functioning well enough to compensate. His body was in shock, yes, but it was working. He crawled out of the wreckage and made his way toward the road, where passing motorists eventually spotted him and called for help. When emergency responders arrived, they found a patient who was alive, responsive, and in pain, but not dying. Medically speaking, this was a survivable situation. To stabilize him, paramedics administered a sedative. This was standard procedure, used to reduce agitation and prevent the body from exhausting itself. In most patients, this medication is safe. In rare cases, however, certain sedatives can suppress the brain's signal to breathe. What the responders couldn't have known was that Pinion had an undiagnosed sensitivity to the drug. His body did not process it the way most bodies do. Within minutes, his breathing slowed. Then it stopped. Despite immediate attempts to revive him, Kenneth Pinion died there on the roadside. Not from the crash, but from the treatment meant to help him survive it. Later investigations found no misconduct. The dosage was within accepted limits. The responders followed protocol. Medically speaking, everything was done correctly. Biologically speaking, it wasn't enough. Pinion survived the event that should have killed him, only to die because his body reacted in a way no one could reasonably predict. In medicine, survival is not a guarantee. It is a temporary condition. And sometimes, the difference between living and dying isn't impact or injury or even error. Sometimes, it's simply how the body decides to respond.